Hi there, my name is Veronica Camba from Section 3, Group 3 of Batch Eximius. Our thesis is entitled The Impact of Fall Risk Management on the Fall Risk Scores Among the Elderly in a Hospice Setting. As nurses, our focus is to help a patient reach his or her maximum functionality and quality of life. Our fundamental concern is the prevention of accidents and injury. Falls are included in these highly preventable yet very common accidents. Also, falls are the leading cause of injuries among older adults. Lack of existing structured program addressing falls is the reason why our group chose this topic. To capture the idea, we have presented a diagram that shows that there is a greater chance of falling as the shade becomes darker. In order to answer the problem, we first identified the pre-intervention fall risk scores and identified existing measures in the institution. Then we implemented the fall risk management for 12 weeks and reassessed for the post-intervention fall risk scores. We associated the fall risk scores with the intervention, then compared the pre- and post-intervention scores, and further analyzed the gathered data. The study will benefit the following: the researchers, the local health setting, nursing education, nursing practice, and nursing research. Study, however, involves an eligibility criteria, and the variables outside the study that may have affected the result were also considered. From the permitted 20% of the population, we will now screen for the first eligibility criteria. Is the client's age 65 and above? If yes, we will now enter the second phase, which is the interview and second observation. We will use the Fall Risk Predictive Factors Assessment tool in order to screen for the second eligibility criteria. Does the client possess risk factors indicated in the Fall Risk Predictive Factors Assessment tool? If yes, he or she will now go to the final assessment, which is the final interview and observation phase. We will again use the Fall Risk Predictive Factors Assessment tool in order to screen for the third eligibility criteria. We will again use the Fall Risk Predictive Factors Assessment tool in order to screen for the third eligibility criteria. Is the client's fall risk score 10 and above? If yes, then he or she will be considered at high risk for falls. We introduce to them the fall risk management for 12 weeks, and then they will now enter the final phase, which is the post-evaluation. We will again use the Fall Risk Predictive Factors Assessment tool in order to assess for their post-intervention fall risk scores. Comparison of the pre- and post-intervention scores have gathered the following results. Pre-intervention scores of the high-risk respondents ranged from 10 to 13, having the mean score of 11, while post-intervention scores ranged from 6 to 13, having the mean score of 8. The difference between the pre- and post-intervention scores ranged from 0 to 6 with a mean difference of 2. Risk factors without significant changes includes ambulatory and elimination status, vision status, and predisposing conditions or diseases. On the other hand, risk factors with significant decrease includes gait and balance, orthostatic blood pressure, medications, and falls history. After the implementation of management for 3 months, there has been a substantial change in terms of falls history. After the intervention, none of them reported an occurrence of fall within the 3 months. Existing measures were recognized, such as installation of handrails, usage of assistive devices such as wheelchairs and crutches, administration of some medications, and promotion of daily exercise. Computing for all the quantities gathered using the paired t-test, the results showed that there is a significant reduction of the fall risk scores of the residents after 3 months. All in all, the objectives of this research were met in one way or another. Although results suggest that there was a significant decrease of the fall risk scores of the residents, the reduction of the fall risk scores cannot be totally attributed to the implemented fall risk management. But still, we can conclude that implementation of a fall risk management has an effect in reducing the fall risk scores among the elderly in a hospice setting. Once again, this is Veronica Camba from Section 3, Group 3. Please vote for us. Thank you and God bless.